So what I've seen in my practice, I might get a patient referred for your classic distal referrals like carpal tunnel or de Quervain's tendinosynovitis of the thumb or tennis elbow. And I have found more often, probably than not, I'm probably looking at a majority now, where those pain, that pain actually is referred from trigger points in these shoulder or scapular stabilization muscles. And the muscle that I see problems with most commonly would be the levator, which is pretty easy to find. If you find this medial or vertebral border of the scapula, and then you find the scapular spine here, this point where they come together up to the superior angle of the scapula, this is where the levator attaches, so it's going to attach from here and then up to C1 and C2. And so then, you know, you're feeling this. This is deep to the trapezius, okay? And so she does have a band through here that's a little more tight and a little more prominent than just this global trapezius tightness that so many of us have. So typically what you're going to do is find what I call ground zero, the area that when you're palpating is the most tender. And then to do a trigger point release, you know, you're going to hold thumb pressure, or you can do 2 fingers, or you can get one of those knobby massagers. But you're going to put pressure on this area to a discomfort level of about a 7 out of 10. And then you're just going to hold constant, steady, even pressure. You know, ask your client, is that about a 7 of 10? Is that pretty uncomfortable? You know, but we're only going to do it for 60 to 75 seconds. So steady, deep, constant pressure, pain level of about a 7 of 10 for 60 to 75 seconds. Now, a lot of clients will get some immediate relief of their symptoms, which, not that there's not an awareness of the tightness here, but the symptoms are usually down the arm, more distally. A lot of people do not get instant relief. I do not get instant relief, but the following day, or 8 to 12 hours later, I will experience some obvious relief of my distal symptoms, okay, so that it's worth that little 60, 75 seconds of suffering. The other thing that I see would be muscular triggers in the rhomboids here. And I've certainly had trigger areas where I would have to choose, because I would be triggering and have painful areas all the way down my rhomboids. But again, you'd find that area. Some will say you can use a tennis ball and lie on a soft mat, you know, like in a OTPT gym, and put pressure that way. But you can do the same thing. You can find the spot and you can do your pressure. This one, I think you tend more to see pain like medial elbow pain, which might present in your clinic as cubital tunnel or ulnar nerve. I've also seen like subscapular pain, where the client will say it's like they're underneath their shoulder blade, where you can't get to it with your fingers, or it feels like that posterior chest wall. The levator usually is going to be consistent with your C6 dermatome, so you're going to see like that client come in with tennis elbow or thumb pain, de Quervain's tendinosynovitis of the thumb, diagnosis like that. What we're going to try to do now is called a positional release. So we're going to try to experiment with head position and arm position until we find that spot where the symptoms disappear. Now with levator, intuitively, positional release, you would think that would be a position of slack, which would be letting your head drop back in extension, okay, and then experimenting with the arm position. But body doesn't necessarily work that way. I've had some interesting combinations in some cases where it would be like a really, really extreme flexion, but you're just going to experiment with your client. Take your arm yourself with your other hand. Okay, so sometimes I've had the client do the arm, because you can come back here with your fingers and find the area of tenderness, and sometimes it's going to be easier for them to tell when we find that just right spot or that just right position by periodically putting your finger or your thumb against the area that was painful. So once we find the position of slack where their symptoms have pretty much disappeared, then like the trigger point release, we're going to hold for like 60 to 75 seconds. And so this is a method that it's a little bit more difficult to do as far as family members doing it for you. but you could get pretty equal relief to the trigger point release, but there's not going to be the discomfort involved like there is with the trigger release.